Case management just historically hasn't had a lot of professional support. So this has been a good way for them to kind of fine-tune their skills, but also gives us an opportunity to assess how they're doing and provide that support.
Walking into these rooms, a lot of times I'm going in by myself on my day-to-day normal, and I leave the situation sometimes thinking, wow, could I have done that better?
You get to hear from the side of your staff, your social workers and case managers who have just went through that simulation, and on behalf of the patient, as well as a trainer or assessor.
Lots of details are provided for the simulation itself, which really makes it easy for our standardized patients and the trainers.
It's getting to frames, it's getting into critical thinking, it's asking questions.
You get to gather everyone's input.
It's letting learners talk 70% of the time and us as specialists 30% of the time.
It is great collaboration. I love being a part of the trainings and watching the videos.
I find that the ACTS website is very easy to go through.
It's been super easy to not only find it in the ACTS portal, but then to also make those changes and utilize it.
The other big piece of simulation is that reflective practice. That critical thinking, reflective practice, what happens in our minds and our brains is so essential to what's happening in healthcare. And so SIM allows us that opportunity to dig into that.
We get so caught up in doing things day to day and just kind of following our own routine and asking the same questions when we're in rooms with patients that it's sometimes nice to kind of step back and be able to kind of look at things from a different perspective or get that feedback.
It's been a great learning experience for me. It's helped me feel more well-rounded as a social worker and a case manager because our roles do intertwine.
I do think it is a good opportunity to get some feedback, maybe become aware of things that we maybe aren't aware of, things that don't necessarily always show up on our employee evaluations.
I do my best every day to try to think, what would I want if I'm in that situation? It makes me feel better about what I do have to say and makes me feel way more empowered when I'm changing anything that I do.
Healthcare has a lot to do with communication and team dynamics and emotional intelligence, and that's just as important as the clinical expertise from those who are serving our patients.
You hope that you're making a difference, but it's nice to know that you're able to fulfill some of that.